Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hola, ¿qué tal, Nita?
Muy bien. I'm fabulous. How are you?
I'm living it up. I have to learn how to say that in Spanish. It can't be too difficult.
No, it's pretty easy. You just hop on YouTube. They teach you everything.
All right. I will do that later today, and then I'll surprise you at the next show.
All right. But no jokes in Spanish. I'm not that good yet.
Okay.
Okay, cool. So
I took Latin. You know, in Latin, they don't teach you how to speak. They teach you how to shut up.
Yeah, but you learn all the roots of words and
I like
all about
it.
Language.
I like Latin, but I would love to learn how to speak Spanish someday.
So would I. Okay, that's our goal for this
we'll
year.
do it together. We'll go
Okay.
down to Mexico or Spain and spend, I don't know how long it'll take. How long will it take to get immersed in the language?
If we practice all the time, we could start emailing each other in Spanish.
I think that's a good idea. Let's do it.
I like it.
Let's make the commitment right now.
All right. I'm writing this down. I write all my commitments down.
That's smart.
Okay. So, but meanwhile, back at the ranch, those listening that already speak Spanish or a million other languages probably have musculoskeletal pain. So here's how we're going to help you out with that today. You'll be able to call the program all hour long and speak with Dr. Darrow and get a free book by phoning 866-870-5752 right here in the studio. And Dr. Darrow's latest book is yours for free when you call the program. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has actually 264 scientific studies. And the foreword is written by Suzanne Summers, who's written many health books herself. So the number again is 866-870-5752. You can also check out the website at www.lastemcells.com. And you can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. That's www.lastemcells.com. What do you think?
I love it. And I'm going to start off this morning by asking you a question, Nita. Are you ready?
I'm ready.
Okay. This is a tough one. Put on your thinking cap.
Okay, it's on. Under my headphones. You can see.
What do bees do if they need a ride? They wait at the buzz stop.
Ooh. Ooh. That's a good one.
I'm going to give you one more chance.
All right.
Okay?
All right. I hope we get a caller soon.
By the way, if you want to talk to me live right now, give me a call. We can talk about all your musculoskeletal complaints, all your orthopedic issues, all the reasons why you don't want to have an orthopedic surgery. There are reasons you may want to, but there's a lot of reasons that you may not want to, because we can generally heal all of these joint issues, tendons, ligaments, pain from really the back of the head all the way down to the bottom of the feet and everything in between, the hips, the knees, the ankles, the toes, the fingers, elbows, shoulders, you name it. So what do you call a monkey that loves Doritos? A chipmunk.
Oh.
Cute, right? Anyway, the number to the show right now, if you want to laugh with us and learn something about how to save yourself from a surgery, give me a call right now at 866-870-5752. That's 866-870-5752. Do not be shy. We like you. We love you. We'd love to talk to you. We want to talk to you about your own stem cells from your body and platelets, PRP, from your blood, and talk about how that can heal you. It is a new age of medicine. Our friend Tony Robbins, if you folks know who he is, he's the greatest motivator on the planet right now. wrote a book called Life Force. That was actually my website, lifeforce.com, and he has it now.
Oh, rude. How rude.
No, it's I'm happy he's got it. He has a bigger ministry than I do in terms of the number of people that he deals with. But the book is all about stem cells, how we can regrow organs and heal people, and all the miracles that take place with stem cells. My work is much simpler than all of that majesty. I just work on the musculoskeletal system. And what we do is we inject ligaments, tendons, joints, and help them heal instead of doing surgeries. I don't like surgeries in particular. I was trained in orthopedic surgery in my training, and I had my boss do my shoulder, and it failed miserably, and I didn't know what to do at that point. And it took about 4 years thereafter until I had a lecture on regenerative medicine, and I experimented on myself. I injected my own wrist and shoulder and healed both of those. And those were both pretty much overnight healings. And then I started I started begging my patients. I said, tried this on me. It worked really magically. I don't think it's going to work on everybody, but it worked on me. And I've seen it work on a lot of other people. Can I try it on you? And everybody who came in wanted to try it because they didn't want to have surgery. And so it's worked out for me. I've been doing it almost 25 years. It's morphed from the old prolotherapy days when we used sugar water as an irritant to bring fibroblasts, create inflammation, bring fibroblasts to the area. And then over the years, it's morphed to using platelets from your blood. We call that PRP, platelet-rich plasma. And then onto stem cells. We take the bone marrow, and Tony Robbins, the great mentor of stem cells today, actually goes out of the country to do stem cells because there's different forms of them that can be done there that are not FDA approved here. Although, honestly, I get this question all the time. Are your treatments approved by the FDA? No, they're not. Most medical treatments are not approved by the FDA. FDA stands for, Nita, do you know what it is?
Yeah, Food and Drug Administration.
Yeah. Is it a drug I'm doing?
No.
Is it a food?
No.
No. So they do stick their nose in every once in a while and muck up medicine, which is sad. And there's a whole political lecture we could do on that, but I'm not going to get into it for this show.
Okay.
We're here basically to heal people.
Do you want to talk to George?
George, you snuck up on me there. I'm so glad you called. How are you? This is Dr. Marc Darrow. You have a friend?
I'm with a friend of mine, Barbara, and I was calling for her. She has a meniscus issue.
Yeah.
Hi, Dr. Darrow.
Hey, what's your name?
Barb.
Barb?
Barb.
Nice to talk to you guys.
Nice to talk to you.
How long has your knee hurt you for, Barb?
It's bothered me slightly for about 5 years,
Okay.
on and off.
Okay. And how do you know it's a meniscus tear?
So it's bothered me for quite a while, and then in November, I was playing pickleball,
Yep.
and I heard a little pop, and
Yep.
as I made a lateral move, and through the course of that workup, I was told that I have, several old degenerative tears and
Yep.
maybe one newer one that I think
Okay.
I did with the pickleball.
Yep.
So I did physical therapy. I got an injection with hyaluronic acid and steroids.
Okay.
That really didn't do anything. And
Okay.
then I went through physical therapy, which maybe helped a little bit.
Okay.
But I've plateaued and stayed the same for about 4 months.
Okay.
So I have been offered a clean-out surgery.
Oh, boy. Don't do
Being
that.
told that, maybe I'll be 50% better, maybe not.
Yeah. Yeah. Maybe 50% worse or maybe 100% worse. That's a surgery I do not like
I would
at
not
all.
Be worse. Pardon me?
The doctor said you would not be worse.
Yeah.
How does he know or she know? I get them all the time where they get worse.
From a clean-out?
Oh, I don't like those at all. I'm going to tell you the story of a clean out. I had a patient who had an ACL rupture. I examined his knee. It was swollen, and it was not lax. It was not loose. That ACL holds the leg bone, the tibia, onto the femur, the thigh bone, and his was not loose. You don't need an ACL to have a good knee. ACL is the anterior cruciate ligament. Too many of those surgeries are done today. At any rate, against my best wishes, he went in for an ACL repair. I said, if you do it, make sure the doctor signs something saying that he will not do a clean out. Well, the guy didn't do any of that. He came back a couple of months later. He was in terrible distress. His knee was 1,000% worse. And I said, what happened? He said, well, he did a clean out. And I said, well, why? All you needed, and you didn't even really need it, but if he would have done anything, why didn't he just repair the ACL? And he says, I don't know, I'm not a doctor. And he ended up having a knee replacement later, which he never needed to begin with. And then the knee replacements I see don't work out that well anyway. Some are fine, and some are fine for a while and then break down. I have people coming all the times with knee replacements saying, I'm having more pain now than before the surgery. Can you help me? Most of the time I cannot, because that's a mechanical joint at that point. It is not biologic anymore. The work I do is growing back tissue, rejuvenating tissue. I can't rejuvenate metal or plastic. Do you understand that?
Yes.
So a clean out, what does that mean? It takes out all the loose, frayed tissue that I think is a bonus. I think it's good for the joint to have that cushion. And I don't send people to surgeons other than for informed consent. I do send my patients to surgeons when I think there's a chance that maybe they might need a surgery. But they end up not getting the surgery, even though the surgeon says they have to do it, and we heal them with platelets and stem cells. Okay, I'm not saying this is a magical treatment. It isn't. It's not going to work on everybody for several reasons. Most of the reasons are because the person's either too active after the treatment or they don't get enough treatments. They try it once and they didn't get what they wanted and they quit. There's other reasons. You can have doctors that don't inject with an ultrasound, meaning they're not looking inside the joint. They're doing it blindly and missing the tendon, ligament, or joint. Or people are taking anti-inflammatory medicines like ibuprofen that block the inflammation you need for healing. Or there's just a bad doctor or nurse or someone who's not trained in what they're doing. And this is one of the problems we're having in this country today. The bad name in stem cells and platelets is coming. And look, I love chiropractors, but they shouldn't be doing these treatments. They should be sticking to what they know. I don't do chiropractic treatments. Same thing with the surgeons. I'm not doing surgery. They shouldn't be doing this work that they don't know anything about and don't believe in. At any rate, to tell you if I could help you, and I say this all the time to people and on the show, I have to examine your knee. I can't tell you over the radio what's going to happen with you. I can tell you this. You probably had an MRI, correct, or no?
Yes.
Okay. That MRI to me means 0. Okay? You can't tell if something's old or new. You may have had what they saw as a, quote, new tear, and that may have been there for years. And then you tweak your knee. I'm going to bet you anything. I don't know the answer, but I'm going to make you a bet because I see it all the time. That pop you felt was not the meniscus. You don't feel menisci pop. What you do feel, though, with a lateral move is the patella. That's the round bone in the front of the knee. That can slide out of the trochlear groove in the femur and then pop back in. And that causes a lot of pain, discomfort, and months or sometimes years of misery. And it's easy to fix. What I do with that is I inject into the joint, get the platelets or stem cells in all the compartments of the knee, get it healing, and then I take a little teeny needle and I go all the way around the patella to thicken up the tissue that holds it in place in the trochlear groove. Okay? Does that make sense or no? And if you want to see these things, go to Google and put in the word patella or patellofemoral syndrome and click on images in the upper left-hand corner and you'll see what I'm talking about. If you were to come in the office, I would do that with you and show you.
Mm-hmm.
So from what you've told me, I wouldn't have a surgery. But you're welcome to do what you want. A lot of my patients don't listen to me, then they come back after the surgery and they're worse. Then they want me to fix them then. It's tougher.
If I understood you, you inject these platelets or stem cells into the synovial fluid in the knee?
No, the synovial fluid needs to come out. If you have extra fluid in the knee, I can see every drop with my ultrasound. To put hyaluronic acid in there, that's an analog of synovial fluid. It's a lubricant. I have no idea why doctors inject knees or shoulders or hips with hyaluronic acid when there's already hyaluronic acid there. If you have a totally...
They said I had some osteoarthritis in the lateral
compartment
aspect of the joint.
Yeah. Well, I would never put hyaluronic acid in there. That's me. It's expensive. It doesn't do anything. And when we inject platelets or stem cells and do the regenerative medicine, the synovial tissue automatically responds and produces enough lubricant if it is a dry joint. But it's pretty rare to have a dry joint. When you have arthritis, you actually typically, and I look at every single joint with the ultrasound, you typically have too much fluid in there, and I aspirate it out before I put in the cells that are going to do the healing. You don't want that fluid in there. It's a space-occupying lesion. Causes pain. Any of that make sense to you?
Yeah. So I don't think I have like an effusion in my knee or any extra fluid.
How would you know, Barbara? Did someone look inside?
Well, I think X-rays demonstrate that.
No, they do not, unless it's a huge effusion. I can see 2 drops with an ultrasound. It's live.
I didn't have an effusion.
You may have an effusion. It just didn't show up on an X-ray. X-rays are good for showing you bones, not effusions, unless it's a giant effusion. And if that were the case, your surgeon would have probably taken it out. Look, I got to say this. I say it on every show. I love surgeons. They do the hardest work in medicine. I don't like the surgeries they do for the most part. Some of them need to be done. Most do not when it comes to the musculoskeletal system. And I see terrible things happen from these surgeries to people that had minimal problems and end up with major problems. So again, I love surgeons. I don't love all the surgeries they do. I have a lot of friends who are orthopedic surgeons.
I just want to be clear. So with the PRP, you inject these cells. And so, for example, I know the meniscus doesn't have a lot of blood supply, so typically it's been hard for it to heal on its own. So these cells react with the meniscus to help it regenerate?
Yes. I can show you before and after x-rays to show you tissue growth. And there's been studies done back actually in the 80s, I think it was the mid-80s, with, I don't know who allowed this to be done, but biopsies were done, punch biopsies to show actual tissue growth. We see what's called granulation tissue after about the 3rd day. Granulation tissue is brand new tissue growth, and then it matures after about 3 months. Barbara, you're very educated. Are you in the medical field?
I'm a nurse practitioner.
There you go. So God bless you, and you're doing good work. And I'm glad that you understand a lot of this. And I'm happy to take a look at it for you. I'll give you the office number. It's 800-300-9300. I'll repeat it for you, 800-300-9300. And you can go to the website, www.lastemcells.com. That's lastemcells.com. Every page there has a spot to email me, and there's also a ton of videos watching these procedures to see if it's something you're interested in. It's up to you if you want to have a surgery. You are a smart person, you know what you're doing. But my way of practicing medicine is be conservative, be natural. Do the conservative thing first. Obviously, surgery is the most invasive thing you can do, and it's not first on my list for anything. I've had many, many injuries, And actually, to tell you the truth, if you haven't heard this before, I've been injecting myself for almost 25 years to regrow the tissue. And I've had success every single time. I'm a good healer when it comes to this, but I'm a bad athlete in terms of I hurt myself all the time. I just injected both my knees. I injected both my knees a week ago.
With the stem cells, why hasn't that been adapted in America? Like,
do you know what the word? Do you know how to spell the word money?
I think I do.
Okay, well, spell that really loud, and then take a look at what you think is going on. I always tell people when they ask me a question about politics, medicine, anything else, follow the money. Every hospital in the country that does surgery would be bankrupt without these surgeries. They make a lot of money. These teeny little surgeries that take a half hour or so make a fortune for everybody. And that drives it drives everything on this planet. Money, 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 money. It makes me sick, and the guys that practice natural medicine don't make much money, but in my book they do the most good. Now look, I'm not putting down medicine, I'm not putting down doctors. You know, doctors are saving lives every day. You go to the intensive care unit, you'll see that. You get sick people. That's what medicine's for. But for stuff that can be done conservatively, do it conservatively. Sure. Don't use high-tech medicine, surgery, and medicine to take care of things that can be done easily without it.
Yeah. And I'm sorry, one other question.
No, you can ask as many as you like. Don't worry about it.
This is kind of a tough one for you to gauge or answer, but a person in my situation, overall, what would you say the percentage of improvement is after a PRP series?
After one, I can't tell you. After a series, probably very, very good if you're the right candidate. But I have to examine you to tell you what that is. We do studies in the office that show that consecutive treatments, people get consecutively better. Mm-hmm. I've mentored, I don't know how many, at least 25 or 30 pre-med students to help get them into medical school by getting their name on research papers. And, you know, we continue this practice right now. So we actually keep track of every single patient that comes through the office and see how they're doing. And I'm willing to share that information with you too. You're, you know, like I said, you're smart, educated, and you can come in and look for yourself. My book, which we're going to send you, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, has a few of those studies in it. And my website also has a few of the studies in it, so you can look at that. But, you know, look, you're a study of one person. I can't tell you how you're going to do.
Right. Yeah. Yeah. Okay, well, you know, this has been very informative, and I want to thank you. Good.
Well, God bless you, Barb. And,
thank you.
You know, between you and me, I think your knee is going to heal.
Excellent.
George, thank you for bringing, absolutely. George, thanks for bringing Barb onto the radio. And God bless you all.
I listen to your show just about every week.
Oh, thank you so much. I've been doing it for 20 years. You must be an old man like me.
I've been doing it for 20 years, but I believe in what you're doing.
Thank you. Well, I believe in it too because it's conservative medicine, and it really, really helps tons and tons of people. It's worked on my body. Anita Valens, who's my co-host, it's worked on her body. And we have we have other radio people that come in. I treat them for free, and it's worked on their bodies. And I'm in love with this kind of medicine. I'll just be honest with you. I'm excited to be in the office. I rarely ever take a vacation. If I ever do, it's because of my wife who wants to. I don't need vacations. My work is my pleasure. It's my joy. It's my love. And if I could be there.
I've got 7 or 8 friends of mine that have gone through these treatments, not necessarily with your office. Some of them live in other parts of the country, and almost every single one of them's got a good result.
Well, that's been my experience too. If they stick with the program and listen to the doctor and don't cheat on the doctor, they do well. Hang in there, everybody, and thank you, folks. We're going to go to the radio show phone number right now. That's 866-870-5752 if you want to talk to me live. 866-870-5752.
Great. You're listening to Living Pain-Free with Dr. Marc Darrow. That's his voice you just heard. Grab a pen or a pencil, write this information down, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.